Arthritis means inflammation. It's not a single disease. Many people just use it to describe joint pains and joint diseases. There are different types of arthritis, and today we focus on rheumatoid arthritis, an autoimmune disease that causes inflammation of joints. For those affected by this condition, day-to-day tasks can be a struggle. And if not managed effectively, it can get worse. My name is Aida Muzati, and Health Nuggets starts now. Dr. Eugene Kalman Genga is a rheumatologist based in Nairobi. He treats patients with rheumatoid arthritis and other autoimmune diseases.
Rheumatoid arthritis is a disease that affects primarily the joints. It causes what we call inflammation. So the science behind the disease is that it's an autoimmune disease. So autoimmune disease means that the body's defense system, which is the immune system, is able to differentiate between germs and self, and it primarily attacks the joints. Though important to note is that it can affect other parts of the body. So in terms of joints that are affected, primarily it likes the hands. So for the hands, primarily it likes the knuckle and the joint just after the knuckle and the wrist. Okay, so what normally happens, you can see in this picture is red, so it becomes swollen and puffy and painful. So some of the symptoms the patient may present with, apart from swelling and painful joints, would be the pain is worse in the morning, and as the day progresses, it gets better. Other symptoms are fatigue. You can get weight loss. Important to note that this disease can go outside the joints. So sometimes a patient come with the lung issues, heart issues, even eye issues. So some of the symptoms the patient will tell you is that in the morning when they wake up, the joints are painful, swollen. There's stiffness of the joint, usually lasting more than 30 minutes. And as the day progresses, things get better. For the ladies, because they do a lot of house chores and everything, the patient will probably tell you that I can't do simple tasks like opening a tinja, because opening a tinja means you have to move the wrist, or cooking ugali, or making chapati, because the wrist has been affected.
We will get to listen more from Dr. Kalman, but first, let's have a look at Pannonicas' story, who is a rheumatoid arthritis warrior.
I was diagnosed with rheumatoid arthritis when I was 10 years, but it was untreated for 3 years since I started having symptoms and some discomforts when I was 7 years. So since people couldn't understand what exactly was happening, most of the time I was taken to different doctors who did not understand the whole thing. So I used to have rash on my joints. My skin was so dry, it would crack, especially on my feet when I walked, it would crack and bleed. And then I used to have joint pains. So also as a child, you aren't able to really understand what exactly it is, because at the same time you're trying to, you're a child, you don't understand stuff. So I was taken to different doctors. There isn't anyone who'd come from the blues and tell me, go and see this doctor, you have rheumatoid arthritis. So they kept treating the symptoms, or rather trying to manage the pain, exercises, whatnot, but they never got to know the core roots. Finally, after I had tried all sorts of medication, that is when our family friend once talked. So she was wondering, hey, what's happening? What was the problem? And that is how now she was a professor. So she went and told me, oh, you can come and see a doctor. So that is how I got to meet my doctor. Finally, when I went to see the doctor, at least I knew this is a part where now at least the pains had reduced, but I did not understand the whole rheumatoid arthritis. I still knew that it was arthritis, no one had, or rather there wasn't any further explanation deeper into it's an autoimmune illness. So, but I got some basic things as I went on. But after maybe college, yeah, that's when I now started digging deeper, because now I started going through some other things that were tagged towards rheumatoid arthritis. I had a growth in my brain. I don't know, I still haven't figured out. It could be and could not be related to rheumatoid arthritis, but yes, so it was removed, and it was a low-grade glioma. So that passed, and then now I started experiencing some other joint pains. So before, I kept on, painkillers, nini. I'm used to the pain, so you don't think it's anything further than just the pain. So 2 years later, after the brain surgery, I went. I had gotten osteoporosis, where the joints, my hip joints, had been worn out, so they were completely worn out. There was no fluid; they were just joints. So I had to have the both the hip replaced. So that is when now you start thinking, okay, maybe. So I got to now understand the whole thing, and know that these are some of the things that could come up because of rheumatoid arthritis, or these are the other things, the long-term things that also, because of the medication, it's just not the disease itself, because some of the medication that you take have some serious side effects. So you have to be knowledgeable or know about these things, because if you ignore them, then you will probably go and see other doctors thinking it's something else, maybe your kidney, kumbe is just the medication. There are also things that I struggle doing. Of course, there are stunts. I love dancing, but there are stunts I cannot do. There are things I'm not able to, but most of the time, so some of those things that I'm not able to is because maybe it's too cold and your joints are in so much pain. Especially in July, your joints go crazy, your hands swell, they become so painful. So even getting some meds from, or even chopping, you can do all those things. So sometimes it becomes challenging when also you feel like, you wake up knowing you can do something, and then later on you realize, after a few attempts, you're just not able to, because of maybe how your body already transformed. So yeah, some of those things they really don't bother me, because there are also some things that still other people cannot do. So
Rheumatoid arthritis affects many parts of the body but can be managed with an effective treatment plan. Coming up next is life after diagnosis and the collaborative approach to manage RA.
So in terms of diagnosis, the first test they do are the inflammatory markers, something called ESR and CRP. In the setting of rheumatoid arthritis, they'll be high. Okay. The next test for terms of diagnosis is something called rheumatoid factor and anti-CCP. So these are proteins that are produced during the whole process of the autoimmune reaction, and that's what attacks the joints. So the higher the level, the worse the disease. Some patients may have one or both of the proteins positive, and some patients, you have a small subset of patients who may have none of the tests being negative. Important to notice that having a positive rheumatoid factor test does not mean you have rheumatoid arthritis. The test should go in an agreement with the symptoms. So that is something which patients not usually have to understand, because there's a small percent, about 5 to 20%, will have a rheumatoid factor positive but have no disease. Other tests that are done in terms of classification is something called a blood count. Usually the blood count, you're looking at the HB. HB usually looks at the red cells. Are they the right amount, or are they reduced? Usually in rheumatoid arthritis, they get low blood or anemia. Other tests are the liver function test and the kidney function test. Why are these two important? Because these two tests will determine ultimately what drugs they'll put you on. Because take, for example, if I have a liver problem, the doctor will probably favor another drug. The last test they probably do is an X-ray of the hands and wrist. And why we're doing the X-ray of the hands and wrist? Because rheumatoid arthritis, it burns the joint. When it burns the joint, we get something called erosions that appear here. So this usually tells us how severe the disease is. Is it mild? Is it moderate or severe? And usually treatment depends on all those things put together. And then as a last part for diagnosis is not just looking at the symptoms alone, we look at the test. We have a calculator where you which looks at the symptom duration, is it more than 6 weeks, number of joints affected, and the lab test. If you score above 6, you have the disease. Diagnosis time takes a bit long. Actually, we have data in Kenya where majority of our patients, more than 50, have had the disease for at least 1 to 2 years before the diagnosis has been made. And the problem with this is that by the time you're seeing the patient, is the goals change a bit. Because by the time they're seeing you, maybe they have joint distraction, they're unable to use those particular joints. So certain patients, sometimes surgical options may apply at that particular time. So usually the treatment goals are one, the first thing is educate the patient, because there's a lot of misinformation out there. And we've heard of stories of people telling you that I can cure arthritis in 4 months or 3 months, which is very unlikely because this particular disease is a lifelong disease. And you must form a good partnership with your patient and the doctor, who's the rheumatologist. So education is good because there are a number of issues surrounding rheumatoid arthritis, like choice of medicine if you want to deliver. You must also look at things to do with cost, because certain drugs are very expensive. There's a drug called rituximab that goes for about 300,000-400,000 versus methotrexate, which is a bit cheaper. So those things also come into play. So apart from education, the next goal will be, the first immediate goal is to stop the pain and inflammation. So for that one, we give something called non-steroidal anti-inflammatory drugs, so things like the ibuprofen, naproxen, the aceclofenac. But this should be used cautiously, especially in the setting of acidity, setting of pressure and heart conditions and kidney problems. Apart from that, sometimes we are forced to give steroids. I know most patients know steroids as the drugs that athletes use to boost their performance. But the setting of rheumatoid arthritis, because some of the drugs take a long time to enter the body, sometimes weeks to months, the steroids give us at least a window of opportunity where we can do what? We can control the inflammation and the pain. The next thing about the goal of rheumatoid arthritis is going to avoid disability and the joint distraction. And now this way we'll be bringing the main drugs. So the options that are available, we call them disease-modifying drugs. They're called DMARDs. So DMARDs have a number of categories. We have the conventional DMARDs and we have the biologics. So the conventional DMARDs have been used for a long time. Things like methotrexate, citalopram, something called leflunomide. So they've been used for a long time. We know their side effect profile. The new kids on the block are the biologics. Biologics are very good drugs. The only issue with them is that, one, cost. They are very expensive. Like there's a drug which can cost you about 80,000-90,000 shillings a month. It's a very good drug, but you must be able to communicate with the patient and tell them that this particular drug costs this much, because you're looking at sustainability. Okay. The last things that you have to look about is nutrition, exercise, and physiotherapy and occupational health, because ultimately we want to rehabilitate you back to your normal life, because there's a lot of misinformation outside there that if you take this particular diet, it may help. The problem also with rheumatoid arthritis is because of stiffness of the joints. So when you get stiffness of the joints and you don't use your joints as actively as possible, the mass will shrink and can worsen the outcome. And a lot of these patients are at risk for things like pressure, heart disease. So we want to encourage them to do what? To exercise. But now the patient may tell you, I'm always tired, I'm always in pain. So these are some of the things going forward should be part of your treatment plan. We have a couple of ways to verify if the patient is doing well or not. We have certain scores or calculators that are available. There's one called DAS28, there's one called CDI, ST. But basically, it's just looking at the symptoms. So the symptoms, we want to make it look like that if today you have got 20 joints that are painful and swollen, at your next review, they should have gone down and then down again, because these drugs take some time to enter. If you note that the patient today has 20 joints, next month has 20 joints, that month 20 joints are still painful and swollen, there's something that is not working there. Is it compliance, or is it just that the patient has a difficult disease? Because right now the way we're treating our patient is that we tailor-made medicine, such that patient A's rheumatoid arthritis versus B and C are totally different. So we should be able to classify them and treat them appropriately. So when we realize they're not doing well, currently the regimen is that we can either go up or down or switch. So usually we start our patients on dual therapy, meaning 2 drugs. The patient that don't do well, we add a third drug. If we notice that the patient is not doing well, we are allowed to switch to the biologics. In the West, because the biologics are funded by the government, you are allowed to start such patients on the biologics immediately from the beginning. But in Kenya, because of cost, we have to go through the step by step and see how the patient gets better. Then with time, we see from there. Another cause of poor control is infection. There are more at risk for infections from the lung and urinary tract infections. So we have to be on the lookout. Maybe could be an infection worsening it. And the last thing also, teeth. Dental hygiene is very, very important, because there have some research showing that there's an association between poor dental hygiene and rheumatoid arthritis control.
Remember the 3 years that I was not treated? That is where my hands happened. So I could feel pain. I tried to do things, but it was just painful. So most of the time if I'm just, if I'm not doing anything, I'll keep my hands like this. So that, because that way they're not painful. So, but then you have to keep doing things for them to be flexible, So by the time, so I could see physiotherapists. They try to do, exercises and maybe keep pressing pressure balls and stuff like that. But because it was still not being treated, it still had more impact on the joints. There's some things that you eat that just cause the flares, like animal products mostly. They cause the triggers, or rather they make the joints flare. They make the pain because of the acidity in those animal products. Also, if you don't keep a diet that causes the body not to build up inflammation, then of course you're going to be experiencing pain. Also, taking alcohol, some of those things I learned the hard way when I was in school. I'd go party and stuff, but then over time now, that's when you realize the pains are there. Yes, because of ABCD. But I used to ignore it because I thought I just take some painkillers. But now over time, you realize some of these things you have to stop them. No, because your body, for you to be able to keep a healthy body, you have to be able to let go of some of those things. So it's the drugs that we take. You have to keep detoxing for you to be able, because maybe your kidneys are doing double time because of the medication trying to break them down. So you also have to learn some of the other things that you can take to help to keep the kidneys healthy. You have to work out to keep your chest from not, because for rheumatoid arthritis you just have to keep doing activities. If you just sit down and not do anything, just know that you're literally reducing your lifespan, because your joints will keep getting stiff. So one day is your hands, the other day is your knees. You'll be on a wheelchair in no time. So you have to fight the pain and be able to push through the pain for you to be able to keep moving. So now some of the meds affect, some of them are acidic, so they can cause tummy issues, headaches. So it's basically, I think most of them is because of other than the major, because rheumatoid arthritis not only affects the joints, but it also affects major organs. So your heart, your lungs, your kidney. So you just have to be able to figure out, is it the dawas or is it the is it rheumatoid arthritis itself? So for you to be able now to address it, because you cannot just jump into conclusion that this is rheumatoid arthritis, but maybe it's because of the meds that you've been taking, especially for the kidneys. So you have to be able to take control of it before it affects so many things.
One common question that I get asked as a rheumatologist is that, Daktari, why me? Where did this disease come from? And to be honest, this is a disease we're still slowly understanding. We know the science is autoimmune, but why patient 1 and not patient 2 or someone 3 is a bit difficult to say. But we have some common things that have been found to be associated in terms of causing you to have the rheumatoid arthritis. So one, we've noticed that it's more in the younger people, age group from teenagehood to about 50 years. Though we had a bit of elderly people get elderly onset rheumatoid arthritis, we've noticed that it's more common in ladies, and we think or we suspect there may be a role of estrogen in terms of the whole science behind the disease. In the West, the ladies male ratio is like 3:1. Locally, Kenya, it's more like 9:1. So you can see it's more ladies that have it. Other potential things that may put you at risk is genetics. Genetics is something which has been studied. They've identified certain genes in patients that have put them at risk for developing this particular disease. At the same time, they've also noted that having a relative with the disease can put you at risk for developing the particular disease. Other things are lifestyle, smoking, bad diet, obesity, and also occupational exposure, like chemicals and the gases have also been associated. But like I said, we are still understanding, and I don't want people to say that if my grandmother had rheumatoid arthritis, I want to get it. We believe that it's multiple things coming together. And multiple things coming together is a better way of looking at it, because it will not explain why sister 1 will have it and the next 2 sisters may not have it. So I think the take-home message is that it's multiple things coming together. So one common misinformation about arthritis is that everybody assumes arthritis is for the old. I think if people take a message from this particular presentation is that arthritis affects any person of all ages. And we had arthritis in the young people, like Kajuju started when she was young. We have in the middle age and we have in the old. What would be good to note that is that at different age groups we have different causes of the arthritis. So in the elderly, it's more what known as osteoarthritis, which means wear and tear. The cartilage has broken down. Maybe they can use this for the knee. So this particular pink stuff here is called the cartilage, so it breaks down over time. So this is what we know as the arthritis of the old people. Versus the younger people is comes early, swollen, puffy, and you have other symptoms like fever, fatigue, and weight loss. So different age groups have got different causes. It is a disease that not many people understand. Even some of my colleagues don't understand. So having someone to go talk to helps. And this is why it's important, because sometimes we encourage our patients to see a counselor, a psychologist, someone who can at least help them cope with what is going on. So it's very, very important to have an open relationship, because if you don't, the alternative is the patient will go to the witch doctor or the herbalist who will tell them, I'll cure you in 4 months. And because they're more of a rapport than you, they'll be able to tell them all sorts of things there.
It hasn't been an easy journey, or because there's so many things. First, my childhood was just cut out. How people talk about the games they played. Some of those things I couldn't do with them. I would have wanted to do them, but then you're not able to, and you're also stopped from doing certain things. And also before the people, especially from where I came from, got to know what it is exactly, they always thought this person is bewitched or something. So I still grew up knowing or hearing such things. So which sometimes when you have dark days, you think, is it? But then over time, after I got to learn more about it, then I just dismiss some of those things. There are certain ways people would treat you. There are certain things that that would emotionally build up, that you don't know how to deal with them, because sometimes you feel like you're asking for a little bit too much, but also you have to remain sane enough to be able to carry on with your life and stuff. So it has not been an easy journey, and also push for things that we don't need, we don't have, that we need, for them to, you know, to make the journey easier for people living with rheumatoid arthritis, say the government, maybe the bills, and also some of those things, the medication, some of the technology that is being used in other places that is not being used in Kenya, that would make it easier. It wouldn't, maybe a child wouldn't have gotten their hands like mine if that information was out there in the past. But also sometimes you wake up, you know, you're like, is this that day? You know, sometimes you wake up, you're like, okay, just God, I need some more time, because sometimes you wake up and your body just refuses to do things. What I'd want to tell people living with rheumatoid arthritis, it's not a death sentence. You can live a happy, normal life by taking your meds. Just follow instructions from what the doctor has said, but also be knowledgeable as an individual to know some of the things that can help you through the whole thing. Also, you have to keep a mental and psychological, try to be stable. How would I describe it? Just try to be, don't look at it in a very depressing way. You can still be able to do so many things. So don't shy off from first, you know, speaking up about it. It's not something to be ashamed of, or also some of the things that affect you through the rheumatoid arthritis. There are so many people that have it. Only that people don't speak up about it, as you know, so openly, but you can find support groups that you can talk about. You can share your stories, and some of them are almost the same, but you have to be able to open up for you to be able to start healing from the inside, because not only does the disease affect your joints or your organs, it also affects your emotional and psychological bit, because of some of the things that society make you look at in a very different way than you would have on a normal day. So just do as much as you can. Also, don't give up. There's still hope.
So I think the thing is, early diagnosis is important. So if you have a joint pain that's not making sense, that is worse in the morning, the swelling, you feel fatigue, fever, it is good to seek medical attention. And if you feel you're not getting the right medical attention, it's advisable to look for a rheumatologist. These days with Google and everything, you can just Google rheumatology and then be able to see a couple of my colleagues. Then you can go visit them. Because the thing is, the early treatment does do a lot.
I would like to thank Dr. Kalman for his time, and most importantly, for educating us on RA. Special thanks to Kanana Kajuju for sharing her story. If you think that your RA is not under control, speak to your doctor to get to see some other management options available. That's all we had for you from Health Nuggets. If you have any questions, you can always reach us on our social media handles as displayed down below on your screen. My name is Aida Muzati. See you next time, and always remember that your health matters.